Great honor on behalf of the Department of Medicine at LSU Health here in Shreveport to welcome you to a COVID-focused retirement ceremony. There is no playbook for such an event. We're going to welcome you to our first, we hope last, attempt at doing this. We have a large number of individuals that are online as well as an auditorium that is appropriately distanced and filled. For those of you who are online, I would ask that you do mute your microphones so that we have minimized feedback and so that we can enjoy everybody's participation in this. Today we have an opportunity to celebrate the efforts, lifetime achievements of 4 individuals who have contributed immensely to our trainees, our institution, our community, and truly our nation. If we begin to add up their impact with Dr. King at over 38 years, Dr. Reddy more than 36 years, Dr. Todd more than 32 years, and Dr. Marion at 16 years at our institution as faculty alone, we know that their more than 122 years of service as faculty have contributed immensely to the wisdom, compassion, and care for our community and our trainees. As best I can tell, that means that more than 3,500 medical doctors, more than 1,000 residents and fellows have benefited directly from their insight and supervision to our communities. I heard someone remark earlier today that it was easier to count the number of doctors in Shreveport that were not trained by the faculty here than it was to count those that were trained. While we are distanced by COVID, we can all join together in celebrating the life and careers of these pillars of the Department of Medicine, and we're going to hear more from our narrators over the coming several minutes. I do want to begin the celebration by saying that I was just informed that Chancellor Galley was unfortunately not able to join because of unforeseen circumstances. He does send his apologies, and with your permission, I'd like to read some brief comments from him. He wants me to remind all of us that today is the day that marks the end of one era for the 4 members of our LSU Health Shreveport family, Drs. King, Todd, Marion, and Reddy, and that collectively these individuals have given 127 years of dedicated service to the mission of the Health Sciences Center. And he wants to convey how grateful he is for all that you have provided and accomplished. It also marks the ceremonial beginning of a new era in our lives. While we will miss your contributions and seeing you daily in the hallway, the impact of your profound knowledge and service to patients and students will continue to live on. May the memories of a job well done bring you joy and contentment during your long and healthy retirement. Golly golly. So thank you for the opportunity to share those words. And I do want to also recognize other members of our leadership and faculty, and I would like to go ahead and welcome to the podium at this point Dr. David Lewis as our Dean of the School of Medicine and Professor and Chair of the Department of Obstetrics and Gynecology for your words. Thank you, David.
Thank you, Dr. Bailey. You know, these retirements are always sad, but one of these days I'm going to get to retire, I think. No, yeah, that's what my wife said. She said, I didn't marry you to be home all day. So, but I want to congratulate all 4 of these people that have been around here for many, many years. Some of them actually taught me as a student, and I still remember that. I see Jay Marion up here on the big screen. Jay obviously did a great job working in the Dean's office with the students. I want to wish all of you, Dr. Reddy, Dr. Marion, Dr. King, Dr. Todd, the best, and thank you for all the service that you've done for our students, our residents, and for the citizens of North Louisiana. Thank you very much.
Thank you, sir. Well, this really is the opportunity to say thank you to some incredibly important people that have done so much for us. We have asked individuals to become the lead for this and to serve as our spokesperson. The first person I'd like to invite to the podium is Dr. Mike Sewell, who will present a overview for Dr. John King. Mike.
Thank you, Dr. Bailey. It's truly an honor to be here for these four individuals. You know, I tell my med students and my interns that I just, as of July, became a PGY 27, and so I've been through med school here quite a number of years ago. Dr. Marion has probably contributed more to the empathy of graduates of this institution than any other individual, with his teaching and his kindness and his compassion. And I can't thank you enough for those things, because those are, people come to medical school to learn a bunch of facts, and you refuse, and for years you have refused to let them leave only with facts, and that is so appreciated. Dr. Reddy, I was speaking to before, and we made mention of how many cardiologists in town that he trained. And so, as Dr. Bailey said, we were trying to come up with the ones he didn't train. I was fortunate enough to be taught cardiology during my residency by Dr. Reddy, and just phenomenal teacher, phenomenal human, and his impact on the health of Northwest Louisiana is just untold how large it is. Dr. Todd has taught so many people infectious disease, sat down with me, taught me one-on-one, sat down in small groups, taught lectures, always available, always an open door. And I was asked to speak briefly about Dr. John Todd, Dr. John King. And, when I got to medical school, I was pretty young. I was actually only 3 months after I turned 20 years old, I started medical school. And nobody in my family had been a physician. I did not have any physician role models. And I had this reverence for physicians, and it was almost as if physicians to me were unapproachable because they were on a pedestal, okay? And so I made it through my first 2 years, which was somewhat of a struggle, especially being younger. Survived those years, put on the short white coat, was terrified, went into the hospital. All the physicians there, still, point of reverence, unapproachable. For some reason, I don't even remember what the reason was, but I had to go to John King's office. And I knew who Dr. King was, but I had never talked with him. And I'd never sat down with him one-on-one. And I had an opportunity to walk into his office. And on his office door was a target that he had shot with his pistol. And it was a very accurate shooting. It was a very good representation of what your accuracy should be. And suddenly, for some reason, I realized Dr. King had a life outside this hospital. It was almost like when you're a kid and you see your teacher at the grocery store, all right? And I had this reverence for these people, and I always thought I'll never be able to be where those people are because I'm not that special. I don't have these things. I went into Dr. King's office. Again, don't even remember why I was there. What I remember was he sat me down across from him, and we talked about pistol shooting. And we talked about a common thing, common interest that we had, and he delved into me as a person and not just a medical student. And we talked about something that was non-medicine. And for the first time, I saw physicians as people and as humans and as people who had lives outside of here. And every single time I talked to Dr. King after that, we would talk medicine, and then we would talk guns. And then we would talk outdoor activities. We would talk walking in the woods. We would talk orienteering. We would talk things that we both had common interest in that was not medicine. And it touched me in a way that I can't really explain. All four of these gentlemen have had an impact. Obviously, 3 of them taught me extensively. But the first time you realize, hey, there's a human side of this, and these guys that I put on this pedestal and I had this reverence for actually took an interest in me, and I'll never forget that, and I'll be thankful for it. All 4 of you guys, congratulations. Thank you so much for the contributions you've made. Northwest Louisiana and the rest of the world is better for having had you here doing what you're doing. And you're part of the inspiration for me after 22 years in private practice coming back here, hoping that I can share with students some of the things that you guys have shared with me. Thank you so much.
So if you could, we do have chairs to present to our awardees on the dais up here as well. That's even harder to do virtually, so I will virtually show folks that they're being presented that. They will be, of course, boxed and forwarded to the individuals and not try to send it across the internet. Our second presentation, I'd like to invite Connie Arnold up to share with us some thoughts and memories she and others might have with Dr. John Todd.
Thank you so much. It is a true honor today to recognize my friend and colleague, Dr. John Todd. For many of y'all who don't know, John had a very interesting career in education. He got his undergraduate degree in German literature from Stanford. He went to medical school at Emory, where he was awarded the highest grade at Emory on his national boards for both Part 1 and Part 2. He started out as a surgery resident at Case Western and then decided to go into internal medicine, where he did his residency at the University of Louisville. Then Dr. Todd came here to do a fellowship in infectious diseases. And it was John King who brought Dr. Todd into the infectious disease program. And a couple of the interesting stories, if you don't know about Dr. Todd, is he was one of the driving forces for the establishment of the HIV viral disease clinic. Dr. Todd was the only physician in internal medicine that would go over initially and see patients, HIV patients. And at a time when a lot of people didn't want to see them. Another thing that John Todd is known for is he is legendary among his patients. And he is legendary because he has driven patients home. He has bought patients who can't afford things that they needed. He calls his patients day or night. He's available 7 days a week. Some of my fondest memories on the faculty here, when I was a junior faculty, John Todd was one of the first people who actually would stop and talk to me. And as an introvert who rarely talks to a lot of people, John would stop me in the elevator and talk to me, and whether he knows that or not, it meant a lot to me. He has, when people talk about John, they talk about how kind he is, whether it's residents or medical students or faculty. And one of the things that I wanted to say about the four men that we are honoring today, especially somebody who's been here, I've been here 28 years, is one of the things that I love about all four of them is that they have been willing to stay. Any of them could have left numerous times, and they chose to fight for this medical school. They chose to fight for the faculty here. They believed in the students that they taught. They loved the patients that were here. And, you know, we've been through some rough times, and they never left. And as a faculty member, that really means so much to me. John was also known for how well he took care of his wife, Betty, before she passed away in 2010. He has two lovely daughters, Stephanie and Karen, hopefully Jonna. I just wanted to let you know, to let all four of you know how much you mean to this faculty. It's always bittersweet to me when retirements come, but for the four of y'all, it really is. All four of them have impacted my career. They have always been so supportive and encouraging and have led me to where I'm at. And so I just wanted to say from the bottom of my heart, thank you so much.
Any comments?
even forgot. I want to give John King and Bert West indeed brought me here back in 1985, and it's been a great experience here. Just had 34 years, had an opportunity to do what people like us want to do, take care of patients, teach medical students and young doctors, and do research. I couldn't possibly mention all the faculty here who've collaborated with me on research, but prominently I remember Burton West, John King, and Connie Arnold. And thank you all very much.
I guess the German phrase would be ausgezeichnet, or outstanding, so thank you very much for that. I would like to have Dr. James Morris come to the podium and share with us his thoughts about someone who has been so impactful. You've heard that from Dr. Lewis and many of the other members of the faculty so far, and that's to say some words about Jay Marion and his impact that he's had while he was here as well.
Let me add my congratulations to each of the retirees. To each of you, I've created or have established a bit of a relationship. It's been truly an honor, Dr. Reddy, to help in your care. To Dr. King, I'll see you in the next few weeks as you come to the hospital. Dr. Todd, we'll see each other eventually when COVID is over at a house concerts at Dr. Jordan's house. And to each of the retirees, I say to you on behalf of all of your students, residents, fellows, and colleagues, well done. Well done, and thank you for your leadership and guidance. Dr. Marion, thank you to Carol and your daughters for their support of you as our husband and father in sharing you with us. This is a bit difficult. J.M. Marion, M.D., Professor Emeritus of Medicine, the Nancy Jane Sintel Seal Professor of Cancer Palliative Care, retired, the Associate Dean for Academic Affairs, retired, faculty member of the Department of Medicine and Feisweiler Cancer Center, and immediate past counselor of the Gamma chapter of Alpha Omega Alpha. So let me just begin with a bit of the academic pedigree. Obtained a Bachelor of Science in Chemistry at the University of Missouri-Columbia in 1973, also known as the other Tigers of the Mizzou Tigers. He graduated from Vanderbilt University School of Medicine in Nashville, Tennessee in 1977, where he was elected as a senior member of the Alpha chapter of Alpha Omega Alpha at Vanderbilt. He completed his internship and residency at Vanderbilt University in 1980, followed by a fellowship in medical oncology at Barnes Hospital, Washington University in 1982. Following his professional training, he served as a faculty member at Washington University School of Medicine from 1982 to 2004, where he was the medical director of the Barnard Cancer Center and director of the Missouri Baptist Cancer Center, the Missouri Baptist Hospice, and the BGC Hospice. Originally, he was involved in medical oncology and chemotherapy and transitioned to the care of palliative care and hospice. Thankfully and subsequently, he joined the real Fighting Tigers, the Fighting Tigers of LSU Health Shreveport, in 2004 as an associate professor of medicine, rising to the professor of medicine in 2017, where he worked for 9 years as the associate program director for the Hematology Oncology Fellowship Program. He was granted an endowed professorship in 2014 as the Nancy Jane Sintel Seal Endowed Professor of Cancer Palliative Care. He briefly served as the acting chairman of the Department of Medicine in his final position as the Associate Dean for Academic Affairs. His last academic lecture was to give the inaugural Ron Ellison Endowment Visiting Professor at the University of South Alabama on Humanism in Medicine. His career has been truly marked as a true educator, a clinical educator marked by the Leonard Tao Humanism in Medicine Award at the LSU Health Shreveport. He was the 2014 recipient of the Alan A. Copping Excellence in Teaching Award. This is LSU, both the Health Science Center campus's most prestigious award for education. And students have nominated him as their White Coat Ceremony keynote speaker in 2015. And due to his Leonard Tao Award, he was admitted to our inaugural class for the Gold Humanism Honor Society. Enough about his pedigree. Let me talk about the Jedi Master. I'm just a Padawan learner who has gained tremendous knowledge from this master clinician educator. Realize that Dr. Marion and I can discuss Star Wars for 3 hours and still have enough material to cover in a future conversation. Our spouses just let us go. They give up after about 20 minutes. Dr. Egerstedt even asked to have a seat behind us at the theater when we would watch a Star Wars movie. We almost accomplished it, except for a sudden acute illness that caused a cancellation. I was never a true student under Dr. Marion. However, the most endearing teaching point I learned from Dr. Marion is perspective. So please pardon the liberty, and I'd like to teach you. Everybody listening, please raise your right hand in the air and point your finger up at the sky. Okay. Now I want you to turn it clockwise. Keep going. Now as you turn it clockwise, I want you to look up at your finger and follow it. And follow it all the way down to your waist. Which way is the circle going? It's going counterclockwise now. That's an example of perspective. And it's something that Dr. Marion has taught each of us in his own way. So now I've taught you the heart of Dr. Marion's educational philosophy. A voice to all, an understanding beyond facts and memorization, and an application of the teaching point that can be used by all students in practice. It's something that we just learned from Dr. Sewell also. I believe I've probably spent the most one-on-one time with Dr. Marion over the last few years. A road trip to Baton Rouge with Dr. Gunjan Cologne and myself, and a few commuting trips home where we each live less than 600 feet from each other. The rabbi, as he's called, which is Hebrew for teacher, has taught me some Yiddish. We've shared different perspectives on religious traditions and customs, and numerous conversations on life, medicine, and the role of physicianship. I want to leave you with a quote from a common favorite author and physician, and myself and Dr. Marion and many others, and again touches on what Dr. Sewell says. And it comes from Sir William Osler, and the quotable Osler. And the quote follows: "The knowledge which a man can use is the only real knowledge, the only knowledge which has life and growth in it and converts itself into practical power. The rest hangs like dust around the brain or dries like raindrops off of stone." Dr. Marion, I return to my descriptors: Master Jedi, Rabbi, Teacher, and I add friend. Thank you for everything you've accomplished and that practical knowledge that you have imparted to us. Thank you.
I do want to thank everybody and all of my esteemed colleagues. Thank you for joining me, my wife, and my family as we celebrate my retirement. It is indeed bittersweet that I already am missing my daily interactions with my colleagues, my friends, most of all, our students. I'm thankful that I've been allowed to continue teaching into my retirement through podcasts, through WebEx teaching forums. The students always inspire me, and I appreciate being able to continue working with them. Most of all, I look forward to returning to campus and shaking a whole bunch of hands and hugging a whole bunch of friends as soon as this viral pandemic is gone. I want to thank everyone and acknowledge how important my affiliation with the school has been to me. I've been inspired and I've been allowed to grow as a doctor, and as many of you know, doctor comes from the Latin word docere, to teach. And by being a teacher here, I feel that I've become much more than a physician. I've actually become a doctor. So thank everybody. James, thank you for those wonderful words. Dr. Bailey, thank you for all of your support and for all the senior administration. I appreciate everything. Love you all.
We now have an opportunity to honor our fourth retiree today, and that is Dr. Reddy. And Dr. Modi, would you come to the podium, please, as someone who knows him so well and can provide so much insight?
I think I had to echo with everyone who spoke. Talk it loudly, okay. I think I can definitely echo with everyone who spoke before me that it's going to be very hard. And if I cry, pardon me. I'm extremely honored. Thank you, Dr. Bailey, for giving me this opportunity to be able to share some words on the retirement of all the 4 professors, and especially Dr. Reddy, a lifelong mentor and a pioneer for the division of the cardiology. Let me give you an historic perspective, as Dr. Reddy always mentioned. Cardiology fellowship was, very competitive in late 90s, early 2000. And Dr. Reddy opened the door of LSU and this vibrant Shreveport community for me and my family. And thank you so much for that opportunity, Dr. Reddy. And now this place, we call a home, just like many of, the fellows and residents around the campus. I distinctly remember, and I can echo that with what Mike just said about the office. Sitting in Dr. Reddy's office on the 6th floor when I came for interview for cardiology fellowship. And something, we know that, it says a lot when we look around, people's professor's office, that it says about their persona, what is their character. And Dr. Reddy's office is, actually one of the most organized place actually that I have seen around the campus. It's like pristine. And working with him over the years, I kind of realized that it's just not office. He himself is such a put-together person, and we all kind of vouch to that. And over the years, also, I learned that, just as his office was pristine, his kind of vision, his dream, his life, and the way he took, the people around him is even more pristine. I told him, after I came here about my dream to become an interventional cardiologist. And he took, me under his arms. He taught me the life skills. He taught me a lot of knowledge. He taught me everything I needed to know to become successful, and now to even help others. And that's so important to us. And now, of all these years, under the legacy of Dr. Reddy and his vision and his leadership, more than at least 100 faculty and fellows dream to become cardiologists have become true. And I think that's such a true honor and such an achievement as an educator. So I really thank you for that. You all know, probably you can read through the CV, that Dr. Reddy has extremely distinguished career. And I don't have to sit through and read through his achievement, because this is beyond my scope to speak about that. He has spent more than 36 years in this institution, and I remember every single day, whether rain or shine, before the sunrise, in his suit and his tie, with the brown bag in his hand, he was here at the campus. While all others, we were kind of slogging in our dirty scrubs and wrinkled scrubs, but Dr. Reddy was here at 6 o'clock in the morning, and people asked me, what is Dr. Reddy doing at 6 o'clock at the work? He's here reading EKG, reading echoes, making rounds, doing everything he needed to do one-handedly. So I think that's something so important that, we as resident fellows, we have learned from him that, yes, you can do it. And also, I think he has really, tirelessly, spent a lot of time towards the dedication and betterment of our division and in school in general. As James said, that we all have learned from Dr. Reddy. And I've seen so many times students say that even now that sitting with Dr. Reddy, reading and learning how to interpret the EKG was one of the best experience that they had over the years. And today even they still remember and ask for you. So that's something so important. Dr. Reddy has so many awards. He has published so many papers. He had so many distinguished professorship and all that. And that if you look at his CV, it goes on for more than 50 pages. But that's not what I'm going to talk about. Today, what I want to talk about is influence that he has on fellows and residents and medical students as a faculty and junior faculty, on our personal character and kind of build that we developed working around with him. He's, to us and many other faculty, is the kind of a father figure. The life stories that he told us, and the romantic book that probably he read and he discussed with us, the scripture, the historic perspective, the ethics lessons, and other so many positive qualities that he has instilled in us. That's so important, and that's what we are going to carry through and probably pass it on to the future generation of our fellows. And that's so important. I see myself, my family, my colleagues, and so many other faculty that we are so lucky to have you as our mentor, our guide, and our professor and our teacher. And also not just him, his family. Shobha is sitting here, his wife, and he and his wife and his family. Shobha has really, been our family. I remember, being every year at graduation party, we'll be going to his house and have swimming pool party and so much nice, wonderful, tasty Indian food, and we felt like we're at home. So that's so important to us, and words alone cannot express our gratitude towards what you have done over the last several years, to just shape our life and make us feel at home. Time flies, and it feels like it was just yesterday. Dr. Reddy actually was, teaching us how to read echoes, and we had a VHS system. It was not digital before, and he would show me how to read echo fast forward on a VHS in 30 seconds, and he was so accurate, didn't miss the point about it, or even how to implant an ICD or defibrillator. And I distinctly remember, actually, instance, back then, 15 years ago, that we had to test an ICD to see whether it works, and test and threshold. And we had to put the patient in defib arrest. And here I am, just as the beginner fellow, so nervous, and I feel like I'm about to pass out along with the patient. And Dr. Reddy standing next to me, he's so calm, so confident, with a smile on his face. And that was amazing. And that actually told me over the years, thinking about it, that just experience itself told me how the confident, calm, and collective persona he had. And then that's something that I would never forget. So Dr. Reddy has opened the door of this LSU for me and so many other fellows and so many other faculty. It's countless people that has trained under him. And that's, we are so thankful for that. And it's so hard thinking about that, him leaving this door, and that's very hard. But I know that, your fingerprint, your words, your wisdom, your legacy will prevail and will keep it in the division of the cardiology. So thank you so much for your love, your compassion, and your courage that you've given to all the children. And congratulations to people who are here and far and everywhere for everything that you've done for us. Thank you so much.
Thank you, Dr. Bailey, for organizing this tribute or celebration. I echo the remarks of all the others about John King, J. Marion, and John Todd. They have been wonderful friends, great teachers, colleagues over the years. The last 36 years I have been here. I cherish every minute that I spent with them. Dr. King actually has taken care of me for several years, and once I was sick, I went to Chicago and fell ill there and was hospitalized in Northwestern Memorial. So I called John and I said, John, this is what it is, I'm here. I said, do you want me to come? I can come and get you here, bring you back here. I said, no, please don't do that. I'll be here for a couple more days and then come back. So such a human being, such a great friend and such a great doctor and teacher, and the same I can say about John Todd, and J. Marion has given wonderful lectures at our course during every summer. It's a lot of fun, so I will miss them all. I would like to say thanks to Dr. Lewis for his kind words, and Kalki, you've been great. I mean, I don't know what to say, but you said you were going to cry, but I'm going to cry here, but thank you for all that. Before I retired, everybody used to ask, what am I going to do? When are you retiring? I thought you retired already, and those were the questions. But now that I'm retired, anytime they see me, they ask me, do I miss work? Am I bored? No, I'm not bored. But I do miss work, coming to work some days. And the aspect of work that I miss most, I was just telling Dr. Bailey, is the interacting between the fellows, the residents, and the students. That's what I miss most. And it's a matter of great satisfaction to me that I can count so many of my former fellows and residents among my colleagues and close friends. So that is deeply satisfying to me. Now, if I may go down the memory lane a little bit, LSU Shreveport, cardiology was organized as a division in 1980, actually. And Dr. Henry Handley was the very first chief of cardiology here. He came here in April of 1980 from University of Kentucky Medical School. Hank and I were colleagues on the faculty there at University of Kentucky Medical School, and after he got here, he used to call me every now and then and say, "Hey, Pratap, why don't you come? Join me." So between 1981 and 84, I made 5 visits, and each time I would say, "No, Hank, maybe I'll think about it," kind of thing. Finally, but with family, I made a couple more visits and then decided to come. And I moved with my family in August of 1984, and Shreveport has been home ever since. This is the longest we have lived anywhere. That includes India. When I arrived here, there were 3 faculty and 3 fellows. Back then, the fellowship program was only 2 years, by the way. And there was no faculty at the VA. We used to rotate 1 fellow left to himself, fend for himself. If there is a question, he would call us on the phone and a consultation on the phone. Occasionally, we would go there, towards the end of the day at 5 o'clock or something and make round and say, well, this is what it is. We used to bring patients from the VA here for cath, and that too, patients used to be brought by ambulance. But sometimes, the patients are having deep trouble and cath lab is empty and you have to bring them here. So one of the fellows once put the patient in his car and brought him here. And there was a huge hue and cry next morning saying, how did you do that? You're not supposed to do that. If the patient dies on the way, this will be a big medical legal thing kind of thing, so that was the thing. And the cath lab was on the 6th floor of the medical school building. It was not in the hospital. And it was a small cath lab where the GI office now is. So, that was the way it was. Dr. Handley, after 22 years of being chief here, left to go into private practice in 2002 when I became the acting chief of the division. And a year later, I was confirmed as the chief. One of the most difficult problems here has been, historically, recruiting and retaining faculty. That was the case throughout. And there were times when there were only 2 or 3 faculty in cardiology covering all the services. And I, thinking of that, I would like to thank all my current faculty and former faculty for their patience, dedication, and staying with me in good times and bad. Not only that, there were times actually we had so few faculty, I had to invite some of our former fellows who are in private practice to come and help us, and they graciously accepted, to name a few, Dr. Trey Baucom, Dr. Jerome Danzel, and Dr. Mike Guzin and Kasabali. They came and helped us in the cath lab and in the echo lab. And so were our VA-based faculty, Dr. Standen, Mosley, and Jimenez. So I would like to thank all of them. My thanks to Liz Ante, who has been there as administrative assistant and program coordinator, and Bonnie Smith, RN, who has been my clinical coordinator for close to 30 years. So I couldn't have done without them. Finally, I would like to thank my wife, Shobha, who is sitting here. Without her help and support, I mean, I would not have been able to carry on the administrative and other clinical responsibilities here. Just as Dr. Modi has said, we had a lot of fun. I mean, cardiology was more like a big family with faculty, fellows, the staff of cath lab, echo lab, and the EK heart station. We had a wonderful time. And again, I like to thank all of them. Thank you. So much for that. Thanks, Dr. Bailey, again. I mean, that's it.
Well, it's sad that we don't have more time to reminisce. I know that you'll have a chance to reach out. Our friends, colleagues, retirees are actually all available to us, some at more distance, but courtesy of the internet, immediately available. We look forward to your counsel. Others, as COVID lifts, as we're able to do more around campus, we hope that you will continue to join us and share in fellowship. My disappointment this afternoon is that I really didn't get to know each of you in the way that many of our speakers have. And it's clear to me as I've listened, the themes of compassion, commitment to each other, commitment to our institutional mission, and I will say commitment to your families personally, but the extended families that I've learned about. I think that's truly rare. I think today, the longevity that you've displayed, what I know of what it took personally, as we've heard, for you to remain at this institution, I know it's here today. I know that it is thriving today. I know that where we will be tomorrow and the next year is related to what you have provided, the investments you've made, and your own personal joy in this institution. And so I hope that on behalf of the Department of Medicine and our current faculty, that we represent you well, that we remember the lessons that you've taught us, and listen to those that I hope you will continue to bring to us as we move forward. Thank you so much for your time, your energy, and for joining us. Appreciate it.